Okay, starting the video. No study materials in the room. Hi, are you Jane? My name is Cheryl. I'll be your nurse today. We're here for a exam of the hair, skin, nails, lymph nodes, and the thyroid. Is that correct? Okay, before we begin, do you have any pain, Jane? Good. Let's start with your skin. Do you have any known issues with your skin? A history of past skin cancer? No? Okay, good. And do you use sunscreen when you're in the sun? Oh, good. I'm glad you do. Okay, so starting with inspection of the skin, I see that your color is light gray, which is normal for a sloth. I see that you have no pallor. I don't see any cyanosis in your extremities, upper and lower, bilaterally. I don't see any jaundice of your skin or your eyes. I don't see any areas of erythema or redness. Overall appearance, I don't see any tan lines. I don't see any varicosities or edema in your upper or lower extremities. On your upper arms and shoulders, I do see that you have a few freckles or nevi, and actually moles or nevi, a couple moles, and then I do see some macules. I don't see any primary lesions. Do you have any scrapes that you're aware of? No? Okay, good. Moving on to palpation of the skin, I can feel that your skin is smooth texture, and fuzzy, just like a sloth should be. I see that your skin is symmetrical on the upper and lower extremities. I don't see any tumors or any abnormalities. Your skin is warm and it's dry. There's no diaphoresis and no coolness of your feet. You have good circulation. Palpation, your CMS, your capillary refill is less than 3 seconds. Upper and lower extremities bilaterally. Also, with your skin, we should check the turgor, and the movement or the mobility of your skin is adequate, and no tenting is noted. Upper and lower extremities bilaterally. I see that. Moving on to your nails, inspection of your nails. They look smooth. The contour is concave. And there's no ridges, there's no opacities. Upper and lower, your nails adhere to the nail bed. And can you do this with your fingers? Good. And then with your nails? Good. The angle of the nail base is less than 160 degrees, and that is normal. No clubbing noted. And your nails are well trimmed. And of course, going back to the tenting, that is a good sign of adequate hydration, so good job. And looks like you take good care of your nails. There's no chipping, and they're not dry. They're well hydrated as well. Moving on to your hair. Your hair is short and it's thin and it's fuzzy, just like a sloth should be. And it's a normal sloth male hair pattern around the submandibular area. Do have some hair growth, that's normal. I don't see any alopecia. I don't see any signs of infestation, and I see there's normal distribution of your hair. It's clean, it's well trimmed. And upper and lower extremities, I don't see any abnormal hair growth or distribution of hair along your body. Your hair color is light gray, and and then the hair follicles, I don't see any folliculitis. Now moving on to your head. So first inspection of the head, it is normal cephalic. It's large, but that's normal for a sloth. And your scalp is freely movable, and I don't feel any. It's symmetrical. Your skull is symmetrical, and I don't feel any crepitus or any tumors or lumps. And is that tender when I touch? No? Okay, good. Okay, I'll just check your masseter muscles while I'm here. Can you turn your head to the left and to the right? And then your paracervical muscles as well. Good. And as long as we're on your head, let's look at your sinuses. Any tenderness there? In your periorbital sinuses? Perinasal sinuses. Good. No tenderness? And moving on to your neck, I've already checked the mobility. The neck is midline and it's symmetrical. Visualization of your neck. Let me tip your head back a little bit. Good. Your thyroid, I don't notice any goiter with inspection. And we'll move on to palpation of the thyroid after the lymph nodes. So looking at your head and your neck, I don't see any abnormal movements or tics. I don't see any evidence of any injury to your head. The movement of your neck, I do see carotid pulsations bilaterally. But they don't appear distended. I don't see any JVD. And again, your thyroid is not enlarged. So can you swallow for me? Good. Yep. I'm looking at your trachea, and it's midline as well, and with the rise and fall of your swallow. Very good. Okay, so moving on again to your neck. What we should do first is look at your lymph nodes. So in the front of your ears, we have the preauricular lymph nodes, and those are not readily palpable, and which is normal. And that's not tender there? No? Okay, good. There's no enlargement. So this is your preauricular lymph nodes, your postauricular lymph nodes behind the ears. Your occipital is at the base of your skull, and in front of your jaw, right here is your, at the jaw angle is your parotid gland, or your parotid lymph nodes, and then your tonsillar is under the jawline. Those are feeling normal. And then your submandibular lymph nodes, those appear normal. They palpate as normal. And then, of course, under your chin, your submental lymph nodes. And then moving on to your anterior chain bilaterally, lymph nodes up and down the front of your neck and your posterior cervical chain in the back of your neck. And then your deep cervical chain, left and right, upper and lower. And then on your scapula line, or your clavicular line, your supraclavicular lymph nodes, those appear normal, or palpate as normal, and they're not enlarged, and there's no tenderness with any of those lymph nodes, correct? Okay, good. So moving on to the cranial nerves, starting with cranial nerve number 5, the trigeminal nerve, I'm going to be testing your sensation of the cranial nerves. And number 5, we're going to test sharp and dull, or soft. And this is the sharp end, and this is the dull end sensation. Forehead. And so I want you to close your eyes, and you tell me if it's soft or sharp. Okay? And we'll begin now. Close your eyes, and good. 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 And then both sides will test sharp and dull. Good. 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 Okay. That's perfect. So now we can test the also cranial nerve number 5. So that tested the ophthalmic, the maxillary, and the mandibular divisions of the sensory nerve. Now we can check the motor function of the cranial nerve number 5. So go ahead and clench your jaw down, and I'm going to have you open your jaw. Good. And I don't feel any clicking. And so hold your jaw open, and I'm going to try and shut it. Good. Against resistance. Excellent. Try to shut it. Good. Yep, you held your jaw open. Good job. Okay, so and then move your jaw back and forth. Very good. Okay, so now that we've checked your jaw strength and your temporal mandibular joint, your TMJ, open your mouth again, close. Good. No clicking noted, no crepitus. Excellent. So moving on to cranial nerve number 7, this is facial gymnastics. This is my favorite. What we're going to do is I'm going to have you smile with and without teeth. So smile without teeth, and with, and puff out your cheeks, and purse your lips, and tongue in the cheek. Good, both sides. Okay, and then close your eyes and raise your eyebrows. And I'm going to try and open up your eyelids. Good, and keep them shut. Good, good job. You kept them shut. Good job. So that's facial gymnastics. And then cranial nerve number 7 is the spinal accessory. Oh, actually, it's number 11. So I'm going to have you shrug your shoulders. Good. Against resistance. Good. And then I'm going to have you turn your head from side to side. Turn to your left, please. Good. And to your right. Good. And then so we already checked your range of motion, your spinous processes, and your paravertebral muscles. We can move on to your thyroid now. And is it okay if I stand behind you for your thyroid palpation? Okay, good. We've already noted that your thyroid is symmetrical. Let's check palpation. So, first of all, I'm going to get my landmarks here. My cricoid process, my cricoid, and the thymus bone. Good, and there's the cricoid. And I'm going to have you swallow. Good, and I note that I'm in the right place because it moves up and down freely with swallowing. And then I'm going to have you turn your head to the left. I'm going to check the right side of your thigh, using the first two fingers. The right side of your thyroid gland, I don't feel any calcifications. I don't feel any tumors or masses. Good. And so let's check the left side of your thyroid. So turn your head to the right. Good. And swallow again. Okay, good. I have my landmarks. Now, can you, good. I don't feel any nodules on the left side of your thyroid. And I don't feel any goiter. I don't see any enlargements. And it's symmetrical, left and right. Very good. Now with my stethoscope here, I'm going to listen to your thyroid and your carotid arteries. And I'm going to check for bruit. So on the right side of your thyroid, using the bell, and the left side of your thyroid, good. I don't hear any bruits on your thyroid. Normal vascular function. And with the stethoscope on your left carotid artery, using the bell again, and your right carotid artery, okay, no bruit, noted. That concludes our head, neck, skin, hair, and nails, and thyroid assessment. Thank you very much.